Hi everyone, can everyone hear me?
Just give me a second, please. Sound Jai Shri Krishna, Jai Jinendra, Jai Swaminarayan. Good evening to you all. Let me just put the music down. Welcome to you all. Once again, GAA is presenting second talk on the importance of the good posture. So the second of the four sessions will be hosted by Dr. Van der Walt, and qualified chiropractic who has been practicing since 2008. The first session was last week, so this is the second part of it. It's the second talk, the importance of the good posture. And we're going to talk about the spinal anatomy. What is good posture? What are the most common distortion, deviations from childhood to adulthood? Let's invite Dr. Zander and continue with our session. All yours, Dr. Zander. Good evening to you all.
Hi there, thank you. Hope everyone is doing well, and
Yes.
thank you for joining. So, for those who joined last week, I can see a few familiar faces. So, thank you again for joining in. Uh, we'll talk about obviously following up a little bit from last time, and obviously explaining about how important our posture is, not only in our physical stature, but also in our emotional health as well. If you have any questions, then obviously I'll try to have some time in between to have some questions and answers. Otherwise, obviously, we can leave some towards the end. So let's make a start. So can everyone see my screen?
Yes, we can.
Perfect. Okay, so like I said, our posture is extremely important when we consider health. Now, there are lots of different variations in terms of what posture is. So obviously, I'll explain that and I will recap a little bit what we talked about last time for those who were present. Now, in terms of what our health is and defining health, it's very important to understand that being healthy doesn't mean not having any pain, symptoms, or complaints. Now, the reason I put this definition is because I wanted to explain and understand that our health is affected, yes, by our emotions, which is obviously the way that we think, also what we're feeding our body, but it's also the structure of the body, which is how well we maintain not only our muscles, our ligaments and joints, and also how that influences our posture and how we maintain good posture. So I'm a very big advocate for things like yoga, which is fantastic to improve flexibility, for things like Pilates as well. And also there's also a lot of other exercises that we can discuss. However, like I said, I wanted to get you to understand that the way you maintain your posture has a direct link and impact on your health as well. So remember, we talked about last time, and for those who knew, the way that our body works is that our brain controls everything in the body. So our nervous system, which is made up of the brain and the spinal cord, controls not only our muscles, which is important for maintaining good posture, but also remember controls all the other functions and structures in the body. So the spinal cord, remember, is protected by the spine, whereas the brain is protected by the skull. Now, as chiropractors, our role is to adjust the spine to mechanically work on improving the structure of the spine which then impacts the nerve, the disc, and all the muscles around that. And when we keep your spine healthy, it's therefore important that to realize that once the spine is healthy, our posture is healthy as well. But if our posture is healthy, that means that the brain can control all of these systems better. So your nervous system is the most important part of the body, and it's protected by those bones. So those 24 bones, remember, control, or sorry, protect the delicate spinal cord and the nerves which exit. Now, those nerves have three functions. So each of these nerves which exit the spine, they have sorry, I'm not a big fan of PowerPoint, so apologies. So each of those nerves in the spine, they have three functions, which I mentioned. So they have a sensory function, which is to control things like pain, touch, temperature, and posture. They also have a function to control our blood vessels, our organs, and our glands. So that's the autonomic part of the nerve. And then the motor part of the nerve is to control your muscles. So when the spine doesn't move properly, it therefore can impact not only the muscles, which is the framework around the spine, but also it can therefore impact our posture as well. Now we have over 600 muscles in the body, and no muscle, as we saw previously, works or functions without a nerve impulse. So if the brain can't control the muscle properly because the nerve is being compressed, therefore that can impact our posture. So that's why it's very important to look after and maintain our muscular system. Because from the age of 30, every year we lose about 1 to 2% of bone mass and muscle mass. So it's very important to make sure that we're doing regular exercise so we can strengthen our bones and we can strengthen our muscles as well. And like I said, our muscles is the framework for the spine and the framework of our body. Now, if we consider what good, healthy posture is, if we look at the spine from the side, it needs to have three curvatures. So we have a curve in the neck coming forwards, another curve in the low back coming forwards, and then a curve in the middle back coming backwards. So the curve in the middle back, that's called the kyphosis, and then the curves in the lower back, that is called the lordosis. The pelvis is here. Down here, this is the coccyx or the tailbone. Now, there are a few variations for what we can get in terms of what can go wrong with the pelvis. So as a chiropractor, we are focusing on the alignment of the spine and the pelvis. So for example, the pelvis can rotate internally, so it can rotate this way, or it can rotate externally. It can tilt forwards or backwards, and it can tilt forwards and rotate or backwards and rotate. Now, the pelvis is very important. So the way I explain to my patients is that the pelvis is the foundation for the whole body and the whole spine. So it's very important to make sure that we're keeping a healthy structural foundation. Now, in ladies, if you're wearing a heel, for reference, if you wear an inch, your body weight is going to go forward by about 10 degrees. So the higher the heel, the more forward the posture goes. So then what happens is you have to start arching your back to obviously to be able to stand straight. So you can therefore see it puts therefore a lot of stress and pressure on the lower back. Now, if we look at someone from the side, this is what a normal, healthy, good posture should look like. So you should be able to draw a line from the ear, shoulder, hip, knee, and ankle. So that is nice, perfect spine from the side and posture from the side. If we look at you from the back, the head should be level, shoulders should be level, rib cage level, pelvis level, and there should be no deviation. You should be able to draw a line in the middle, and the body should be level between the left and the right. Now, what you have to just take on board and bear in mind is we will usually have a discrepancy in the shoulders because we are dominant, and the dominant shoulder gets used more, so that should normally be lower. So just bear that in mind. The other very important thing we have to consider is the ankles and the feet. So a lot of people have, for example, flat feet or fallen arches. Now, that will have a effect on the whole body because if that ankle collapses, that means obviously we're putting more stress and pressure on the inside of the ankle. And then the ligaments on the outside of the ankle are getting stretched. That will then directly affect the knee, which then affects the hip. And remember, the hip inserts into the pelvis. So if the hip is rotated, it then is going to affect the pelvis. And because I said the pelvis is the foundation of the whole spine, that can then affect the rest of the body. So I work closely with podiatrists as well. And if I find that one of my patients has an issue with the feet, that's always something that I have to consider. And obviously to go through some rehabilitation to strengthen those arches. Now, in terms of posture, these are the muscles which affect our standing posture. They call the anti-gravity muscles. So these are the muscles involved in keeping you upright. Now, if there is an imbalance in any of these muscles, you can therefore see how that could lead to some postural distortions. So, for example, the neck flexor muscles, they normally get tight because unfortunately everyone spends so much time on using these. And because we don't work then on compensating to strengthen up the muscles in the back, that then causes the head to creep forward. If the hamstrings, so the hamstrings are the muscles at the back of the thigh, they attach into the bottom part of the pelvis. So if they are tight, they will then pull the pelvis down. So it's very important to work on assessing whether or not you might have any of these imbalances, and therefore obviously work on stretching or rehabilitating things. So these are some examples of some postural distortions. So if you look at this person from the side, you can therefore see that she has rounded shoulders. She also has a forward head posture because the head is forward compared to where the shoulder is. And her pelvis is tilted backwards to compensate. Here, again, she has forward head posture, but that pelvis is now rocking the opposite direction. Can everyone see that? Okay. Then if we look at from behind, here you can see she's leaning towards the right-hand side. The spine is curving towards his right-hand side. The shoulder on that right side is elevated as well. So for example, she might have a curvature in the spine. She might have a scoliosis. So scoliosis is a S-shaped curvature in the spine. Whereas in here, again, shoulder is dropped, head is tilted, and then obviously his body, spine and her body will be leaning towards that side. Now, how I assess posture and how other chiropractors or other medical professionals might assess your posture is using the software. So this is amazing software where we basically just take some photos of you and we can assess how your posture is. So if we take photos of you, the software will come up and map those landmarks which are measured. So it will measure the shoulders, the rib cage, the hips, and then the ankles, and then it draws a line straight in the middle. And then we can assess whether or not you might be leaning towards one side or there's a difference in the shoulders and how that might be impacting your health. Same thing from this side. So in here, again, you can see the head is coming forwards and there are some other distortions. So this is a really good and effective way that we can objectively measure posture and postural corrections and improvements over a period of time. So this is one of my patients, just as an example. So in this image, this was December 2023, and this was 2 months later. So the software will come up with these measurements. So in this image, his head was 2.64 centimeters forwards. In this image, it was actually backwards. So you can see the significant improvement in his posture. Now, another way that I and other chiropractors might assess your posture is by taking x-rays. So this is a normal example of a normal low back x-ray from the front. So we're looking at the hips, we're looking at the pelvis to make sure that it's level, and then we're looking for the spine to be fairly straight. Okay. And then in here, this will be the coccyx. These dark shadows will be gas in the intestines, and then we have the ribs coming down in here. So this patient, you can see the pelvis is level, the hip spaces are normal. However, if we look at the shape of the pelvis, it doesn't look nice and level. So in this case, that person's pelvis is rotated towards the right-hand side. So the right side will be here. So in her case, the pelvis would be something like this. Then if we look at this person's x-rays for the neck from the side. So when we look at the neck x-ray, there should be a nice curvature. So that is the lordosis or the curve I mentioned earlier, following the back of the joints. Then we have the 7 joints of the neck, and then all of those are separated by the nice healthy disc. So the discs in our spine act like cushions and shock absorbers, and they allow space for the nerve to exit. So this is again a normal healthy neck x-ray. So in this person, if we compare, can anyone tell me the difference? So the difference is the person's lost their neck curvature. So if you follow the back of the joints, you can see the neck is straight. There's no curve. Okay. And I'll get back to why that curve is so extremely important for not only your posture, but for your health as well. Okay, so when we talk about posture, there are a lot of different components to what your posture is and what your posture should be like. So we have sitting posture, standing posture, sleeping posture, sitting at a computer, your walking posture, carrying a handbag or a backpack, how you lift, and how you use your phone or a tablet or a computer, things like that. Excuse me. So I will try and group them and then discuss the best ways for you to look after your posture, taking these things into consideration. So we've already talked about the importance of just a normal, healthy standing posture and what that looks like. If we consider your sitting posture and how you get out of a chair, so the best way to get out of a chair is not just to stand up. The strongest muscles in our body are the thigh muscles. Okay. So they're called the quadriceps. So it's really important for you to make sure that you utilize and use these muscles, not only in getting up from a chair, but also lifting. So the way that I would recommend for you to get out of a chair would be to lean forwards. So your center of gravity is coming forwards, and then you put your hands on top of the thighs, and then push up with your legs, keeping your back straight, and then standing up like that. Okay. Now, in terms of your sleeping posture, please do not sleep on your front. It is the worst posture you can do for your spine and for your back and for your health for three reasons. If you have children or grandchildren and they sleep on the stomach, please get them out of the habit as soon as possible. When we sleep on the front, there's three things that happen, which is bad. First thing is the pelvis, it tilts down. So again, you can see it's putting a lot of pressure and stress on the lower back area. And remember that nerves in this part of the spine, they control things like the bowel, the bladder, the reproductive organs, and the legs and feet. Second thing that happens is that your middle back has the rib cage attaching into it. So you're lying with all of your body weight, or most of your body weight, on your chest. So that limits how much your lungs can expand to be able to get oxygen into your body. And then the second problem is that you can't keep your neck straight. So you have to turn to rotate it so you can breathe. So you can see how much tension that's causing in the spine, the spinal cord, the arteries, and everything else. So the best sleeping posture will be either on your back with a pillow underneath your knees and a nice contoured supportive pillow because this will keep your spine level. Or you sleep on your side in the fetal position. So the fetal position is with your knees bent and then a pillow between the knees like that. Okay. In terms of sitting at a computer or a desk, what we mean by sitting with hips and knees 90 degrees is this. So 90 degrees, the leg is straight and the knees are straight. You need to have a back support in here to make sure that you have that curve and that lordosis, remember, in your lower back. Because when we sit, most of the time what happens is people get comfortable or lazy and they end up slouching. So look what happens to the back and look what happens to the pelvis. So you want to be sitting nice and straight with, like I said, a pillow or just a rolled up towel, placing that in the lower back area and making sure that your screen is at eye level so you're not looking downwards. Okay. In terms of walking, if you're going for walking, if you're carrying, for ladies, if you're carrying a handbag, please don't put it repeatedly over one shoulder because obviously it's going to start pulling the shoulder down. The spine is going to start compensating or twisting, and it causes some muscle imbalances as well. In terms of just general sitting in a sofa or a chair, again, it's the same principle of sitting like this. Now, majority ladies would sit, for example, cross-legged. Now, what you have to remember is when you sit cross-legged, your pelvis doesn't stay where it is. If you're putting, for example, your right leg over the left, your pelvis is going to drop down and it is going to flare out like this. Now, if you keep doing that, the pelvis will eventually get stuck in that position because we have muscle memory. You're literally training your muscles to start pulling things out of alignment and then it stays there. So if you do want to sit cross-legged, fine. I don't have any issues with it. However, make sure that you alternate sides. Same thing with standing. If you're standing, don't repeatedly stand with all your weight on one leg, because again, the hips and the pelvis are going to drop down like this. Okay. In terms of lifting, always bend your knees. Bring whatever you're going to pick up close to your chest and your body, and then use, like I said, your thigh muscles to push yourself up. Because the way that your brain works, if you go down to pick, for example, a pen from the floor, if you were to go down and bend like that, and then obviously just come up normally, the problem is your brain doesn't calculate that it has to lift up your whole upper body weight with the muscles in your back acting like levers, having to pull your upper body upwards. So your brain only tells you picking up a pen. So a pen might weigh 10 grams. So your brain calculates picking up a pen, but it doesn't engage your core muscles and it doesn't use the muscles in your back because then obviously they are pulling your whole upper body upwards. So that's why it's very important, regardless of the weight that you picking up, that you always bend your knees as much as you can and contract your core. So that's pulling the belly button in, clenching the buttocks, and clenching the pelvic floor muscles. So that's principle of trying to stop yourself peeing midstream. So that is how you're contracting your pelvic floor muscles. And then if you're using your phone, please make sure that you don't look down and you raise it up, which I'll explain the effects of looking down in a second. Everyone with me so far? Good. So for those who followed last week, but for those who are new, chiropractors will work on this. So it's called a subluxation. So essentially, it's just a joint in the spine which has lost its normal movement or alignment, which then affects the communication between our brain and our body. So this is what chiropractors work on. So that then becomes a brain problem because the brain doesn't receive information from the spine properly. Now, those subluxations can and do cause postural distortions because once that joint loses its normal position, that area is not going to get healthier. The muscles around it are not going to get healthier. The disc is not going to get healthier. So it's really important that we work on keeping the spine healthy to make sure it doesn't degenerate. And if we keep a healthy spine, we're keeping a healthy brain. So these subluxations and obviously life stresses and strains cause postural problems. Now, what happens is, as I mentioned, the curve in the neck is very important. What happens is forward head posture long term leads to things like pinched nerves in the neck, disc herniations or disc bulges. It can also lead to arthritis in the neck. But probably one of the most significant impacts on your health is that it can, excuse me, it flattens out the curve in the neck. And once that neck is straight, our spinal cord gets stretched by between 5 to 7 centimeters and it causes disease. So the spinal cord is what the brain uses to control everything in the body. It's the information highway. So if that is constantly being stretched forward, again, that is not a good thing. The most significant things which are influenced by your posture are things like your blood pressure, your pulse, your heart rate, your digestive health, as well as your lung capacity. So our lung capacity is how much oxygen you get when you breathe. So if we have forward head posture, and on top of that, we have 5 to 7 centimeters of spinal cord getting stretched, we can lose up to 30% oxygen, meaning you're only getting 70% oxygen when you're taking breaths in and out. So that's why it's so important to maintain and for us to keep the spine healthy throughout our life. Now, when you look down on your phone or when you're reading or when you're brushing your teeth or when you're cooking or cleaning, the principle is the same. If you're looking straight, your head would roughly weigh about 5 kilos or 11 pounds. Now, the further you look down, the heavier the head then becomes. Okay? So if you're looking down at about 60-degree angle, that is about 60 pounds of weight on the back of your neck and shoulders, which is 27 kilos. So that is that large dog sitting on the back of your neck. So that's why, like I said, it's so important to please raise everything up, lift the computer screen, lift up your phone. Don't continuously look down if you're brushing your teeth. Look straight and brush your teeth. Because all of these changes will start working on improving and maintaining good posture. Okay? Any questions so far? Anyone learning anything?
Quite a
So,
lot.
sorry, Dr. Zander. So, what's the correct posture for sitting at a desk for long hours?
Well, first of all, you shouldn't be sitting at a desk for long hours.
True.
Uh, because obviously your spine in your body is not designed to sit, it's designed to move. So you need to be taking a break every 30 minutes, ideally,
Yeah.
because obviously your leg muscles act like pumps. So when you're standing or when you're walking, the calf muscles squeeze the blood from the legs back to the heart. Problem is if you're sitting for a prolonged period of time, all the blood then pools in the legs.
Yeah.
So your cardiovascular system then starts working harder. So if you are having to sit for a long period of time, which again, I don't recommend, I would recommend that you basically just do things like calf pumps. So calf pumps is basically where you just go on your tiptoes and you squeeze and pump your feet into the floor. It's the same thing that I recommend for you if you're going on a long haul flight,
Mm.
because by doing that, you're squeezing the calf muscles and that then pumps the blood back to the heart.
Yeah.
In terms of posture, again, like I said, you need to have back support. If you're looking to get a new chair, you can get things like a saddle chair. So a saddle chair, I don't know if you can see, is that blue chair that I have in the corner.
Mm.
So on those, it's generally impossible to slouch because of the way that it's designed. And that's 30, 40 pounds. If there's no budget and the sky's the limit, the best chairs I would recommend is from a company called Herman Miller.
Mm.
But they are eight, 900 pounds plus. Okay. But again, like I said, there is no perfect chair because your body and your spine is not designed to sit. It's designed to move.
Mm. And
Okay.
what about the expensive recliner chairs that are supposed to do us a lot of good?
Well, I can see your husband enjoying a nice recliner there.
That's
So
right, and I have one
so
too.
I hope he's nice and comfortable.
Yeah.
Again, yes, that's fine. But again, it's important to make sure that you're not slouching too much because the whole principle with a recliner is basically comfort. It's not for support. So rather than sitting nice and straight, the recliner will basically get you to do something like that. Okay.
Yeah.
So if you want the recliner for comfort, then yes, use it for comfort. However, I won't recommend using it for comfort for a prolonged period of times.
Okay.
So, would you suggest daily habits or exercise to improve postures?
Yeah, so again, that's normally on a case-by-case basis. So
Yeah.
again, when the patient will come and see me, obviously I'll take a medical history and then I'll obviously take photos of their posture and usually take x-rays so we can see what their spine looks like and obviously make sure it's safe for me and more specific for me to give you the specific care and recommendations.
Mm.
However, in general, you can do things like just shoulder rolls, so just forwards and backwards. You can do chin tucks. So chin tuck is basically taking the chin and tucking it backwards and making a double chin. So that is to strengthen those neck flexor muscles I mentioned earlier. And then you can do some side tilts for the neck. So it's
Yeah.
basically just bringing the ear to the shoulder, but not hiking the shoulder up. So just a nice slow movement, bringing the ear to the shoulder, holding for about 5 seconds, bringing it back to the middle, and then also doing the same on the other side.
Till once on the
Yeah.
posture.
And
Can
then,
your body be affected if you are holding a stick in your hand? Because sometimes if your balance is not right, you are being advised by the doctor to walk with the stick. So is it more harmful to go for a walk with the stick, or is it does it actually help? Because I
again, that's
found
that's a
myself
difficult
in the big.
question without obviously understanding the big picture.
Right. Okay.
But generally,
Because
no, it won't be really affecting things. It's more for support. So I would rather
yes.
have you walking with a stick for
Right.
support rather than trying not to walk without it, because then the risk of falling is then going to be increased.
Okay. Right. Yeah.
Okay.
So
So
would you
just
say
to
standing posture just as important as sitting postures?
Mhm.
Absolutely. But again, when you consider what gravity does to your body and to your spine when you're standing, the discs and joints in your low back are under about 200 pounds of force. When you sit, it's 300 pounds of force. So that is why sitting just for your back is obviously worse than standing.
Yeah.
But also, it's really important to work on breathing. This is your diaphragm. Your diaphragm, what most people don't realize, is actually one of your 29 core muscles. So when we talk about your core is made up of your abdominal muscles, the muscles on the sides called your obliques, the pelvic floor muscles, the muscles in the buttocks, and then the back muscles. But it's also made up of the diaphragm. Now, one of the best ways for you to work on strengthening up your diaphragm is to practice breathing techniques. And that's also beneficial not only for your cardiovascular system, but it's also very significant, important as a way to manage stress and anxiety. Now, there are numerous ways for you to breathe. I'm not going to go into too much detail, um, but that's obviously something we can discuss if need be at a different time.
So
But
does
it's very important, sorry, it's very important, like I said, to work on improving the function of the diaphragm. And as I said, everything in your body is controlled by your brain and your nerves.
Mm.
So in our neck, we have three nerves, which then control the diaphragm. So C3, C4, C5 control the diaphragm. So again, when your posture is forward, that puts more stress on the neck. And that puts more stress on the nerves, and those nerves then obviously control the diaphragm. So the diaphragm is weak, it then obviously can also impact the spine, the ribs, and therefore your posture.
Mm.
Yes, you can ask.
Yeah, I was just about to say that how does the posture affect breathing, especially during sleep or workouts?
That's a good question. So during breathing, we have different stages of, oh, sorry, during sleeping, we have different stages of sleeping. So we have non-REM sleep, one, two, three, REM sleep, which is the deep sleep where you normally dream, etc. Now, again, going back to the sleeping position, if you're sleeping on your stomach, that gets compressed. So that's why it's not a good idea to sleep on the stomach because you're not going to be able to get enough oxygen because your diaphragm is getting compressed.
So you know
So
when we are when the babies are not sleeping well and we put them on their chest, that's wrong, isn't it?
yeah, yes, but it's also in a way good because obviously the baby then learns to hold up their heads to
Yes.
strengthen up the muscles in the neck.
Right.
So there are times, yes, with babies that I would say, yes, it's okay to sleep on the stomach. However, from probably around age 2 or 1, then it's something you have to start getting them out of the habit of.
Mm. Okay. Okay.
Can I ask a question, doctor?
Yes,
You're sitting cross-legged on the floor. How long should one sit?
as long as you're comfortable.
Oh, it doesn't affect the spine, yes?
If you're sitting and you're really slouching, then yes, obviously it will affect the spine. But generally, it's not going to cause any issues.
Oh, thank you.
That's okay.
Can I just quickly ask before you move on? Is when you've got that saddle chair behind you that you mentioned.
Yes,
So you're saying the posture is good on when you sit on one of those. So I think dentists use those a lot of the time, don't they?
yes,
But they're also looking down a lot for many hours in the day.
yes.
What's the best thing for them?
Are you a dentist yourself?
No, my son is. Uh,
Yeah, well, I do get a lot of dental dentists or dental nurses. I've got a lady at the minute, and
mm,
yeah, she basically telling me she's having to sit like this all day, every
mm,
day. So unfortunately, there's not really a way that we can get around that in terms
mm,
of just work stress, but we have to work around her. So in her case, I've got her to change her mattress, her pillow, and obviously go through a specific plan to work on stretching and strengthening different muscles. So at least the
mm.
body is able to cope better with the effects of her job.
Right. Yeah, understood. And like say he also goes to the gym. So is it beneficial for him in the line of work he does, or I don't know, he's carrying weights and stuff and thinking, oh, they think it's good.
Well, it is good, but again, if he gets his spine checked, that's obviously the best starting point because obviously, if he has his spine check up and we can obviously assess what his posture looks like and what his spine looks like on an X-ray, then
Mm,
I can obviously either me or whatever other chiropractor he'd like to see can then work on a tailored plan for him. And
mm,
I work with a lot of personal trainers or gym instructors or PTs or yoga instructors where we work
mm,
closely with them so they can work with the client to get
mm,
them the best plan so they know exactly what stretches and what strengthening exercises to do, how
mm,
frequently they need to do that, how many sets they need to do, etc. Because again,
mm.
everyone is different.
Yeah.
So
Yeah.
unfortunately, I can't say there's kind of one specific exercise that I would recommend for your son. But
Mm,
again, it's more just kind of generic advice.
yeah. It's quite important to have an X-ray done of your spine to begin with, is that right? If there's an issue, maybe, or
If there's a
certain.
clinical indication, then yes.
Right. Okay. Okay. Oh,
Okay, guys. So I know it's late, so we have to run along because I know everyone wants to have dinner most likely.
Can I ask
So
one more question, please? Very quick one, very, very quick. Please, please, please. Is it better to sleep on the right or the left side at night time?
it
Please.
doesn't matter. It doesn't matter.
Doesn't matter. Okay.
Some
Thank you.
some people have a conception about obviously you don't sleep on your left side because of the heart, but honestly, it doesn't make a difference.
Okay. Thank you.
That's okay. So your posture is very closely linked to the brain and things like your memory. So as you can see, you're easily sitting upright people find it easier to remember and recall positive thoughts. Okay. Basic research finds that your motor system, which is basically your muscles and tendons and ligaments, and how you maintain your posture, strongly affects your emotions and your memory. So therefore, if we keep healthy spine and healthy posture and keep maintaining good exercises, then obviously our mind will be happier and healthier. So I have to skip so we can finish on time.
Can I ask two quick questions?
Yes.
What's the maximum pillows I can sleep with? And what's your phone number?
My phone number I'll give you at the end. First question is honestly, this is the brand of pillow that I'd recommend, if you can see it.
You see it?
No, I can't. What is the name?
The brand is called Royal Rest.
Royal Rest.
So it's a brand I've been using since I've graduated. So it's
Royal
17, 18 years now. So I just find they're quite comfortable. It's a contoured pillow. It's not memory foam, but it's foam. So that is designed to keep the neck level. Because if you're sleeping on a soft pillow, remember your head is a bowling ball. So if you put a bowling ball on something that's soft, what's going to happen? Well, that sinks in, and then obviously the neck does that. If it's too high, then obviously then the head is going to get elevated, and then again it's going to affect the rest of the spine and the body. So you need something that is going to keep all of this straight,
Okay.
rather than, like I said, that or too high, that. So contoured pillows are designed to basically keep the spine straight.
Okay. Right. Right. Phone number now.
At the end.
Okay.
telephone.
So say again?
Yeah, telephone number. Can you leave it on the screen, your number?
Yeah, I'll give that at the end. Thank you.
Yeah.
So as I mentioned, your posture affects every function from your heart rate to your blood pressure to your digestive health to your breathing capacity, etc. But it also impacts your autonomic nervous system. So your autonomic nervous system is this part of the nerve, which controls, like I said, your blood vessels, your organs, glands, and things like that. Now, that is what we reference when we talk about your stress or your fight-flight response. So when your body gets stressed, all of these things occur. So your pupils dilate to get more light into your system. Your heart rate accelerates because your heart needs to pump blood into your muscles, and it squeezes the blood out of the organs and pushes it into the muscles. Your pancreas releases glucose to fuel your body because your body is preparing to run or to fight something or someone. And it shuts down the immune system and all the bad stuff. Now, your posture is closely linked to the function of your autonomic nervous system. So rather than being in a fight-flight response, we want to maintain the body and posture so that you're in a healthy state, which is what we call your parasympathetic. So that is your rest, growth, repair, taking it easy. So if you have healthy posture, your brain can coordinate better between these two systems and is more likely to go to and stay and remain into this good response. Okay. And last few things, and then we'll have some more questions if you have any, and then I'll give you my number. So this is what your brain does, and this is what chiropractic does to your brain. So your cerebellum is the back part of the brain. The cerebellum is an important part of the brain because in relation to what we're talking about now, it maintains your posture. and it controls your muscle tone. Then we have the back part of the brain, which is this part that is called the brainstem. That is where our cranial nerves are housed. So we have 12 cranial nerves. The first one is the olfactory nerve, so that is the nerve which controls the sense of smell. Second nerve is the optic nerve, so that controls your vision, etc., etc. Now, the 11th nerve, that is called your accessory nerve. That nerve controls the trapezius muscle, which is one of the main posture muscles, as well as this muscle in the side of the neck, which helps to rotate your head. So when we have an issue with the upper neck, which is usually at the first or the second joint, that then affects the function of the brainstem. So if the brain can't control the postural muscle, you can therefore see how your posture might be declining because the muscle can't hold the weight of the head. Now, the other significant part of the brain, which chiropractic works on, is called your prefrontal cortex. So that part of the brain is involved in things like your mood, your emotions, but also, importantly, your coordination. So hand-eye coordination. So when chiropractors work on the spine, we are changing that part of the brain, meaning that your brain can coordinate your body better. And it also then influences, obviously, your cerebellum, meaning that your brain can control your postural muscles better. And just for reference, your spinal cord, which, like I said, is your information highway, that is surrounded and encased in water to conduct electrical signals at lightning speed. So please make sure that you drink enough water, because if you're dehydrated, your nervous system can't function properly. 2.5 liters of water is the recommended intake. Now, obviously, if you're young or active and doing a lot of exercise, or depending on your lifestyle, obviously that might need to be increased. But generally, the recommended guidelines is 2.5 liters of water. Your brain is majority water. It's about 70% water. So if you're dehydrated, your brain is not going to work properly. So please make sure you drink enough water.
Thank you for that one.
And then finally, when chiropractors, like I said, work on your spine, yes, we can work on improving your posture, but it also improves lots of other components which are related to your posture and your coordination. So like I mentioned, it improves the part of the brain that controls your coordination, and it controls how well your brain can control your arms and your legs. And it can make you stronger. So a single adjustment that a chiropractor does improve the signals from the brain into a muscle equivalent to doing 3 weeks worth of strength training. Well, that's quite significant. So yes, everyone should have their spine checked, and no, there is no age limit. And no, unless there is cancer in the spine or other significant issues, there are no contraindications to having a spine checked. And there's my number.
Let's read off.
Oh, 8076.
So, Dr. Zander, there's a question. How to avoid locking fingers?
I've got it here.
What's
Say
it?
again.
How to avoid
008
locking
Yeah.
fingers?
076
Yeah,
167.
I don't know what you mean by that.
it's a bite.
I don't know. There's a
Explain.
question there on the chat.
What does locking fingers mean? Like that?
That or probably your toes. Locking fingers. I don't know. Unless this person
Can we
comes online.
get an explanation so I can understand a bit better?
Pranam, could you explain what you mean?
One.
Pranam?
One.
I think when somebody's got rheumatoid arthritis or something, that's when your toes lock. I don't see any other reason for locking them.
Oh, there she is. Hold on. Unmute. Hello?
Well,
Hello, can you explain your question?
Yes, yeah, I'm trying to. Yeah, no, my fingers get locked because of arthritis, actually.
Would you mind
okay.
putting your videos on? It will be really
Yeah, I'm
nice.
trying. Just a minute, yeah. Sorry about that. I'm having. Yeah, I'm on it now. Yeah.
Thank you. Would you mind explaining what you mean?
Yeah. I think I've got arthritis, and what happens is if I'm holding cards or doing something, or even holding a phone, suddenly my fingers just lock up, the joints.
Okay. Well, in terms of trying to not fix it, but to help, there's a lot of dietary advice that I can suggest. Now, obviously, I can't say yes, definitely do it because obviously I don't know your medical history. But obviously, in terms of your muscles, like I mentioned, your muscles need water to work properly. So when we get dehydrated, usually we'll get things like cramps or spasms in the muscle. So, like I said, just maybe increase your water intake.
Sure.
And then there's other things like the minerals and vitamins that we need from the diet. So that would be things like sodium and potassium and magnesium.
Yes, yeah, I've tried that actually, yes.
And then other things, it's just because arthritis is inflammation. So you need to try to reduce inflammation. And obviously, the food that you're eating can either exacerbate inflammation or it can reduce it.
Okay.
So obviously, it might be an idea to see a nutritional advisor or nutritionist so they can work out a specific food plan for you. But just for reference, obviously, there are foods. Can everyone still see my screen or no?
Yes, we can see your screen. Oh, not your screen. We can see you.
Okay, let me see if I can share the screen so we can.
Yeah, how important is your spine?
Okay, can you see that?
Yeah.
Yes.
Okay, so that's for you, but in general, these are the things that obviously you like to be avoiding and things that you would like to add into your diet, which will, like I said, either fuel inflammation or fight it.
Yeah. Okay, yes, thank you.
Can you enlarge the screen a little bit so we can see what it's actually written? Thank you.
So anti-inflammatory are they the ones we should avoid?
No, the inflammatory things are things you'd like or you should avoid. So this is what you need to avoid, and this is what you should add.
So you should. So the green one is to add or avoid?
No,
the
red
green one is to add.
Okay. Yes, because I was told I shouldn't eat tomatoes. That's why I'm asking.
Yeah, like I said, I can't say that definitely this is
a
something that you need
guideline.
to.
I understand. Yes.
Yeah, so again, you need to consult with a professional so they can obviously advise you accordingly.
Sure. Thank you. Yes, that's fine. Thanks.
You're welcome.
There's another question. You were talking about pillows. So are memory foam pillows not as good?
No, they're okay, but like I said, they need to be at least contoured because at least the contoured pillows is designed to maintain the shape of your spine rather than just like a normal standard shaped pillow, because they will then sink in.
Yeah. Are there any more questions? Anybody?
Hi there. I just wanted to know, what was the name of the brand of the chairs that you recommended? You said that there were some chairs that might be a little bit more expensive, but it's the ones that you said were all standard.
Herman Miller.
Okay.
How do you spell that? Sorry.
HERMAN.
Yeah.
I'll put it in the chat box.
Okay, thank you.
Herman Miller. Okay.
It's a German company for reference.
Anyone else who would like to ask him a question? No?
Thank you.
Okay, then I'm going to say...
I've got one question.
Go on.
I've got a drop foot for 5 years after my hip replacement. I've already had surgery on my lower back, 3, 4, 5. 4, 5 is cage and bolt. 3, 4, 5 was shaved off because it was touching. Now my back is starting hurting quite a lot because it's been 5 years since I've had the drop foot. What can you do other than tendon transfer?
Well, prior to having the surgery, did you try any other therapies?
No, I was fine. I had the surgery, the back surgery. I was
But I
fine.
understand. But prior to having the surgery, did you try any other therapies?
Yes, for years I had it, and that was the last resort. That it was completely gone. So, and then my spinal cord was squeezing my nerve. So that was the reason for fusion and whatever. But I was fine after that. But when I had the hip surgery 5 years ago, that's when I developed a drop foot. And because I'm not walking properly, because of the drop foot, my back has started hurting a lot more.
Okay, which foot is the drop foot and which hip was replaced?
Right hip was replaced and it was a right drop foot.
Okay. Yeah, that's a very detailed answer.
No, I just wondered if there's a magic potion to it. So
unfortunately, no. I have had one patient who had a drop foot, which I cured. I didn't cure, but he was a mid-30-year-old big Polish patient who had a L4-5 disc bulge. And he had a foot drop as well. And it took about 6 months, and then he regained the full use of his foot. But that was by doing just the manual adjustments and obviously whatever exercises we went through and home recommendations. If you've had back surgery, the problem is you will always develop scar tissue. And scar tissue is not like normal healthy muscle. It gets stiff, it's rigid, and it has a bad blood supply. And it limits how well your spine is able to move. And that takes 12 to 18 months to heal.
Mine was 7 years ago, and my spine is completely worn out. They've said there's nothing much they can do with it. It's only pain management.
I'm one of those people that will always try and help myself. However, if I feel it's not something I can help you with, I will always try find someone who I can advise or recommend you to, whether that be to try to do like decompressive IDD, which is interdiscal disc decompression, or whether that be some acupuncture or massage or whatever. So I can't say I can't give any advice without obviously assessing.
No, that's fine. I've gone through all those venues. I've done acupuncture. I've done that. I've done the traction, and I've done all that for years. I had it done before I went into further surgery. But I just wondered if there was anything else because it's causing a lot of problems now. It's a lot of wear and tear. That's basically it's wear and tear.
Yeah, but again, I'm not a fan of saying wear and tear because I have patients in their 20s that have wear and tear. So it's not old age and it's not wear and tear. It's just basically how we look after our bodies.
Okay. All right. Thank you.
Thank you very much for
thank you.
It's been really helpful. William says that he's been trying to call you on that number and hasn't managed to get through, is there a specific time he can call?
Well, I've had someone trying to call. I've tried to call 3 times today. It's a 0203 number, so I don't know if that's your number. And it just goes straight to this line is unavailable.
We're an 0203 number.
Okay.
What's the best time?
Let me just double check I won't say the whole number, but just it's
Ending.
020370. Is that yours?
No, 715.
No, that's fine. Okay.
Okay.
No, you can call whenever. So I'll be in the office tomorrow all day. So it'll either be me answering or my PA.
Okay, we keep trying.
Otherwise, just email us. You've got the email address.
No.
Or I can give you my PA's mobile number, so you can just send her a WhatsApp message.
Okay, that'll be helpful.
Yeah. So her number is 075.
Yes.
Can you put it on the
39.
chat, if you don't mind, please?
Quiet area.
Okay, the number is on the chat. If you guys want to copy it, please go ahead and copy it. And meanwhile, I'm going to thank you all for being part of today's session on posture. We've learned how important posture is, and not just for physical health, but also for mental well-being and energy levels. From identifying poor posture habits to understanding their long-term effects, we now have a clearer idea of how simple daily adjustments like how we sit, stand, and use our phones can make a big difference. So a big thank you to Dr. Zander for sharing practical tips and answering our questions with such clarity. Let's try to incorporate at least one posture improving habit into our routine starting from today. So small changes done consistently can lead to a long-lasting benefits. So next week will be our third talk, and the third talk will be on emotional well-being, stress. So Dr. Zander will be well prepared with us to explain what stress is and how we occur stress. Dr. Zander, thank you very much for a lovely session we've had, very informative, and hope to see you next week on time again.
Thank you everyone for joining.
Thank you all. Yeah.
Thank you
very
all.
much.
Thank you all. Take care, and we shall catch up again
Thank you.
next week,
Thank
Thursday.
you. Thank you,
Same,
Paddy.
same
you.
timing, same link, and the password. Thank you again. Take care, all. Good evening to you all.
Thanks.
Bye.
Thank you, Donna.
Bye.
Bye.
Bye. Bye.
Bye.
No.
Bye, everyone.
Bye.
Bye.
Bye.